Below is a list of the types of cancers in the body according to the prevalence in 13 main types. All cancers types are 160 differ in distribution and case. Lung cancer, breast cancer, prostate cancer, colon and rectal cancer, melanoma cancer, pancreatic cancer, bladder cancer, non-Hodgkin lymphoma cancer, leukemia cancer, kidney renal cancer, endometrial oval cancer, liver and intrahepatic bile duct cancer, thyroid cancer. Bladder cancer. The bladder wall is made of several layers. Most bladder cancers begin in a layer called the transitional epithelium, urothelium, which is the inner layer. Inside the line of the ureter, bladder, urethra and parts of the kidneys. Cancer may also develop in other types of cells in the bladder. Transitional cells or tissue are stretchable tissue and connect organ fluid to another organ fluid. Such kidney to bladder cancer is most common in white men over age 55. Possibility of this cancer is 5% of all cancer cases. The following help transitional cell cancer of the renal pelvis and ureter to appear. Having a personal history of bladder cancer. Smoking cigarettes. Research shows that smoking is the cause of about 50% of all bladder cancers. Taking a lot of certain pain medicines, such as phenacetin. Being exposed to certain dyes and chemicals used in making leather goods, textiles, plastics, and rubber, painter, printers, hairdresser. Due to chemicals. Truck causes of fume. Car exhaust system welding. Taking certain diabetes medications. If you've taken pioglitazone, Actos, for more than a year. If you've taken the chemo medication cyclophosphamide, Cytoxan, for a long time. Signs and symptoms of transitional cell cancer of the renal pelvis and ureter. Blood in the urine. A pain in the back that doesn't go away. Extreme tiredness. Weight loss with no known reason. Painful or frequent urination. Chronic irritation and inflammation in the bladder. Transitional cell cancer of the renal pelvis and ureter is a disease in which malignant cancer cells form in the renal pelvis and ureter. Kidney renal cancer. The kidneys filter the blood coming in from the renal arteries to remove excess water, salt, and waste products to become urine. Also, they have another roles such control blood pressure and order the bone marrow to generate more red blood cells if needed via special hormone. 4% of all cancer cases are kidney renal cancer. Average age of this type of cancer is about 65 years old. Most are between 60 to 70 years old and uncommon below 45 years old. The exact cause of kidney cancer is unknown, but some things can increase your chances of developing cancers are often linked to cigarette smoking. Double the chance. Being exposed to certain cancer-causing chemicals. Renal cell carcinoma and other types. Renal cell carcinoma. Almost all kidney cancers first appear in the lining of tiny tubes in the kidney. Clear cell renal cell carcinoma. This is the most common form of renal cell carcinoma. About 7 out of 10 persons has renal carcinoma cancer have this subtype. The cells that make up clear cell renal cell carcinoma look very pale or clear. Papillary renal cell carcinoma. This is the second most common subtype. About 1 in 10 renal cell carcinomas are of this type. These cancers form little finger-like projections called papillae or chromophilic. Chromophobe renal cell carcinoma. About 5 out of 100 persons have renal cell carcinomas. Rare types of renal cell carcinoma. These subtypes are very rare, each making up less than 1% of renal cell carcinomas. Collecting duct renal cell carcinoma. Medullary carcinoma. Multilocular cystic renal cell carcinoma. Mucinous tubular and spindle cell carcinoma. Neuroblastoma-associated renal cell carcinoma appear in young children. Mixed subtypes may exist. Other types of kidney cancers include transitional cell carcinomas, Wilms tumors, and renal sarcomas. Transitional cell carcinomas don't start in the kidney itself but in the lining of the renal pelvis W where the ureters meet the kidneys. This lining is made up of cells called transitional cells that look like the cells that line the ureters and bladder. Wilms tumor. Like bladder cancer, these Wilms tumor, or nephroblastoma, is a type of childhood cancer that starts in the kidneys. It is the most common type of kidney cancer in children. About 9 of 10 kidney cancers in children are Wilms tumors. It has 2 subtypes. Renal sarcoma. Renal sarcomas are a rare type of kidney cancer that begin in the blood vessels or connective tissue of the kidney. They make up less than 1% of all kidney cancers. Benign kidney tumors. Non-cancerous. Some kidney tumors are benign. This means they do not metastasize or spread to other parts of the body, although they can still grow and cause problems. Benign kidney tumors can be treated by removing or destroying them, using many of the same treatments that are also used for kidney cancers, such as surgery, radiofrequency ablation, and arterial embolization. The choice of treatment depends on many factors. such as the size of the tumor and if it is causing any symptoms, the number of tumors, whether tumors are in both kidneys, and the person's general health.